Treatment for peptic ulcers and H. pylori are antibiotics to kill H. pylori bacteria. If you have an H. pylori infection, your doctor may prescribe a combination of antibiotics, such as amoxicillin, clarithromycin, metronidazole, tinidazole, tetracycline, or levofloxacin. You may also need to take a proton pump inhibitor, PPI, or bismuth subsalicylate to help the antibiotics work better. PPIs to reduce stomach acid and promote healing. PPIs are medicines that block the production of acid in your stomach. They can help heal peptic ulcers and prevent them from coming back. Some examples of PPIs are omeprazole, lansoprazole, rabeprazole, esomeprazole, and pantoprazole. You may need to take PPIs for 4 to 8 weeks, or longer if needed. H2 blockers to reduce stomach acid and relieve pain. H2 blockers are medicines that block a substance in your body that stimulates acid secretion in your stomach. They can also help heal peptic ulcers and prevent them from coming back. Some examples of H2 blockers are ranitidine, famotidine, cimetidine, and nizatidine. You may need to take H2 blockers for 4 to 8 weeks, or longer if needed. Other medicines to protect the lining of your stomach and small intestine. These include sucralfate and misoprostol. Sucralfate is a substance that coats the ulcer and protects it from further damage from stomach acid. Misoprostol is a synthetic prostaglandin that helps prevent stomach ulcers caused by nonsteroidal anti-inflammatory drugs, NSAIDs. Antacids to neutralize stomach acid and relieve pain. Antacids are over-the-counter products that can provide quick relief from peptic ulcer pain, but they do not heal the ulcer. They can also cause side effects such as diarrhea or constipation. Antacids should be used in combination with other medicines, as they do not heal the ulcer. The treatment regimen that is best for you depends on your medical history, the cause of your peptic ulcer, and the severity of your symptoms. Your doctor may also recommend lifestyle changes, such as quitting smoking, avoiding alcohol, and limiting spicy foods, to help your ulcer heal and prevent it from coming back. You should follow your doctor's advice and take all your medicines as prescribed. If your ulcer does not heal or comes back after treatment, your doctor may check for other causes and prescribe a different combination of medicines. There are different regimens for treating H. pylori and peptic ulcers, such as clarithromycin-based therapy. This is a common regimen that involves taking a proton pump inhibitor, PPI, and 2 antibiotics, usually clarithromycin and amoxicillin, for 10 to 14 days. This regimen is effective for patients who have no risk factors for macrolide resistance, such as prior use of macrolide antibiotics, or high prevalence of resistance in the region. Bismuth quadruple therapy. This is an alternative regimen that consists of a PPI, bismuth subsalicylate, metronidazole, and tetracycline for 10 to 14 days. This regimen is effective for patients who have risk factors for macrolide resistance, or who have failed previous clarithromycin-based therapy. Levofloxacin triple therapy. This is another alternative regimen that involves taking a PPI, levofloxacin, and amoxicillin for 10 to 14 days. This regimen is effective for patients who have risk factors for macrolide resistance, or who have failed previous clarithromycin-based therapy. Concomitant therapy. This is a newer regimen that combines a PPI, clarithromycin, amoxicillin, and metronidazole for 10 to 14 days. This regimen is effective for patients who have no risk factors for macrolide resistance or who have mild to moderate resistance. Sequential therapy. This is another newer regimen that involves taking a PPI and amoxicillin for 5 days, followed by a PPI, clarithromycin, and metronidazole for another 5 days. This regimen is effective for patients who have no risk factors for macrolide resistance or who have mild to moderate resistance. Combination drug therapy for peptic ulcer disease and H. pylori infection often includes at least 2 antibiotics, an acid reducer, and sometimes a bismuth compound. One such prepackaged drug combination is Pylori, which contains bismuth subcitrate potassium, metronidazole, and tetracycline. These medications work together to treat peptic ulcers with Helicobacter pylori infection. Pylori is usually given together with an acid-reducing medication like omeprazole, Prilosec. This combination therapy is recommended for people who have peptic ulcer disease and are known to be infected with Helicobacter pylori, H. pylori. The right antibiotics combinations usually kill Helicobacter pylori, H. pylori, bacteria that are the cause of many peptic ulcers. In addition to these, the FDA has approved a 3-drug combination of omeprazole magnesium, amoxicillin, and rifabutin, Talicia, Redhill Biopharma, for the treatment of Helicobacter pylori, H. pylori, infection in adults. This treatment is designed to address the high and growing bacterial resistance and diminished efficacy of clarithromycin-based standard of care therapy. It's important to note that no regimen has a 100% cure rate for H. pylori infection, and there are few, if any, regimens with a 90% cure rate. Therefore, it's crucial to follow the prescribed treatment regimen and complete the course of medication to ensure the best possible outcome. Vonoprazan, sold under the brand name Voquezna among others, is a first-in-class potassium-competitive acid blocker medication. It was approved in the Japanese market in February 2015 and in Russia in April 2011. Vonoprazan is used in the form of the fumarate for the treatment of gastroduodenal ulcer, including some drug-induced peptic ulcers, and reflux esophagitis, and can be combined with antibiotics for the eradication of Helicobacter pylori. Co-packaged combinations of vonoprazan with amoxicillin and vonoprazan with amoxicillin and clarithromycin were approved for medical use in the United States in May 2022. Vonoprazan is a potassium-competitive acid blocker, PCAB, that inhibits hydrogen, potassium ATPase-mediated gastric acid secretion. The choice of regimen depends on several factors, such as the presence of H. pylori infection, the severity of the ulcer, the patient's medical history, allergies, and preferences, and the availability and cost of the medications. Your doctor will prescribe the best regimen for you based on these factors. The specific dosage and duration of the treatment plan are crucial, and it's essential to follow the guidance given by the healthcare professional to ensure the effectiveness of the therapy and minimize the risk of antibiotic resistance.